Hi, my dear friends. Welcome back to my new vlog. This week, also, I was completely free of symptoms. I did try a water fasting for one day as my doctor friend suggested. I had water diarrhea on that day, and they said it was from the water fasting I tried. I could have only ashcut juice, butter coffee, lime water, and buttermilk. I have to do water fasting on every fifth day from now on. So coming back to my case history, uh, uh, I had to extend my stay and rest at home for 2 more months, August and September 2007, after my experiences of cross reaction with anti-epileptic medicines in July 2007. Finally, the next month I resumed my studies. People other than friends and faculty there at college behaved very weirdly looking at my ghost like appearance. I already had an inhibition of fear of how my patients would react. My first patient was at the prosthodontics department who was very supportive of my disease condition. The love, affection, and consideration instilled a lot of positivity in me. But there were some students and faculties who were not supportive as I expected. Yet I expect all to be considerate. No, but still, after a gap of nearly 3 years, as I rejoined in the 3 year junior batch, so I did expect a small level of adjustment and consideration. The doubtful attitude towards me, whether I could complete my course, was very explicit. But my attitude was like I never took any emotions to my heart. I let everything pass over me. I never let anything enter my heart. Actually, this nature was modeled after my experience with this disease condition. In between these, I had experiences of pseudo-seizures in 2008. Since this occurred for quite a number of times in between my sleep, I started having doubts whether this was a case of another lupus relapse. But later, it was diagnosed as pseudo-seizures or maybe another version of panic attacks. So I started my medication for this panic attack in 2008, and I did see a small level of betterment after that. But still, the pseudo seizures occurred occasionally. Finally, towards the end of last year, that is in 2020, I had to again undergo on and off hospitalizations, as it was seen that between my sleep, I was undergoing jerking, gasping, and breathing problems. I consulted a neurologist and he advised a sleep study earlier this year, and I was diagnosed with central and obstructive sleep apnea, which in turn caused disturbed breathing in between my sleep. I decided to get a breathing assistance machine as advised by my neurologist and ENT specialist. And meanwhile, I started a new diet and yoga practices for good breathing as well. And this actually helped me overcome the sleep apnea completely without the help of sleep assistance machine. Later, I found myself completely free from fibromyalgia and irritable bowel syndrome as well. I'm extremely grateful to my naturopathy friends who advised me this new diet plan and lifestyle changes. Next week, I shall talk about the adverse drug reactions which showed one after another in due course of time after 2008. See you next week. Until then, bye.